Governing hosted an invited group of state and local government leaders in Washington, D.C. for its first ever summit on the cost of government in September 2010. At a time of permanent financial crisis, when there is little prospect of returning to fiscal balance, how do we go forward? Governing correspondents interviewed leaders from across the country in search of answers. In this segment, Confronting Healthcare Reform, here's what they had to say.
Healthcare, which is bigger as a challenge, states can do a lot. There's a common myth that it's got to be federal, but that's not the case, actually. We regulate healthcare at the state level. And healthcare markets are really different from state to state. I mean, if you looked at Louisiana's healthcare marketplace compared to Massachusetts, it's like two different countries. Actually, the state level is a good place to work.
You've been quoted as saying that you think health reform will be the toughest implementation of federal policy since civil rights legislation. Why do you think that is?
Well, health policy itself is very emotional. It touches everybody close to their family and their personal lives. It's extremely complicated. And then, of course, as you know, it's very controversial right now. Basically, the political spectrum is divided almost down the middle between those who ardently feel that we must find a way, and the ACA is the vehicle to cover most people in the United States, so that that individual who has cancer or who's worried about their child having access to care can get care. And on the other side of the spectrum, folks who are pretty ardently against any kind of increased government role, which clearly there is in ACA, any increase in government role in domestic policy whatsoever, and specifically in healthcare. The other kind of innovation that's going to be required in healthcare is trying to contain the costs of Medicaid. And the states have done a good job by keeping fees down. Sometimes it's at the expense of paying less for more services, and so I think the challenge will be to move the delivery of medical care under Medicaid programs that the states pay half or a quarter of, depending on the state, to move that towards a much more efficient and effective model of what services get provided to the population.
What we did in Florida and in Louisiana was move towards an integrated delivery model, what we call a coordinated care delivery model, where providers link together and partner with a managed care organization to develop a more cost-effective delivery system. And that model has proven to be effective. In Florida, they've when you compared the areas where we did the reforms, $176 per member per month cheaper for state taxpayers to provide services in the new reformed model that we did at the state level. And outcomes actually improved, quality actually improved measurably. So I think states should have a more critical role in this rather than less. The biggest Pac-Man of state budgets right now is Medicaid, and it's going to get worse. And I think that one of the things states really need to look at is the model, for instance, what was done in Florida with their reforms and what's been done in Louisiana in terms of moving towards an integrated delivery model, where instead of an individual being in a fragmented delivery system and trying to navigate that system, they're in a system where there's an accountable organization responsible for their care and measuring the quality of care that's delivered. I think when you do those things, states will see that costs will on a per person, costs will go down.
Insights. They're a governing thing. In the magazine and at governing.com. Made possible through the support of NIC, the e-government people.